So this is what we want to talk about if we can ever get the presentation started, and even if we don't get it up, that's fine. We're here to talk about diabetes and exercise and how to manage your diabetes before, during, and after exercise. And it's obviously, we want people to exercise. It's good for you. We tell you to do it. And then when you do it, you have to figure out how to manage your blood sugars. And so there's always problems with highs and lows. And it's one other variable that is difficult to manage and difficult to figure out. And so I do not have diabetes, and so I'm an endocrinologist, and I'll speak a little bit from my knowledge. But what we really want to do is hear and talk about people's own experiences. So y'all are the experts in how to manage this. And some of you have had great success, I'm sure, with this issue, and other people not so much. And so if we get the opportunity, I'll run through some slides that kind of show some different approaches to exercising with diabetes, some different ways to think about it, how to manage your insulin and your carbs during the diabetes based on your blood sugars and that sort of thing. But also, we want to have a lot of time to kind of open this up for discussion, for questions, for comments from you guys to talk about, if you've had a specific problem or a specific type of exercise, or if you're wondering how to approach something, this is an opportunity to learn from each other about that. So in the meantime, I also want to introduce these guys. I'm actually let them introduce themselves. Two people who are experts in diabetes in two different ways, because they have diabetes and they're also professionally, they work in diabetes. And so these are, we're really lucky to have these guys here to talk about their knowledge and their experiences together. So.
Hi, my name is Maggie Crawford. I have type 1 diabetes. I am a scientist at Dexcom in research and development. And I also love playing outside. And the activities I like to do usually take me places where I need to be able to handle anything that gets thrown at me. So I'm pretty good at always having a backup plan and just planning ahead so that I'm never stressed about my glucose. And I'm happy to talk with all of you about this, as I'm sure we all have great experiences doing that.
Thanks, Dr. Crawford. She just got her PhD. I'm Laura Barba, and oh, hey. I know a lot of you in the room. This is kind of fun. I'm a nurse practitioner. I work at UCSD and at Rady Children's. And yeah, I'm living with diabetes as well, but I think just working with so many people and talking to so many people on a daily basis, exercise is something that always is like, just like, how do I deal with this? Or how do I, so I've learned, I was listening at the tail end of Stephen Ponder's talk, and the thing that kind of rang true was everybody's different. And so everybody has a different experience, and their body works in a different way, and they have different types of reactions. But I think that there are strategies that everybody can use, maybe in little different ways. And as we were kind of talking about your own personal exercise experience, we can kind of use some, or talk about how you might use some of those strategies. And so hopefully we'll get into that a bit today.
Great. Okay. So it looks like the slides are working. Yay. And no seizures, I hope, yet. Okay. So, all right. So we already had a chance to do our introductions. These were some slides that Maggie and Laura had sent in, and just kind of talking. I don't know. Do you want to just briefly say something about this?
Yeah, this is me again, Maggie Crawford. But I think looking at this, the middle box is what techniques do I use to manage diabetes, and I think what would be great for everyone to walk away with is like more techniques, right, or more skills. So these are things that I thought ahead of time, like, all right, these are things that really help me and that I think I would like to share. So one of them is, as I said, preparing to be self-sustainable for long periods of time. Also, you never know what's going to happen. So I backcountry ski a lot, and there's times where all of a sudden a blizzard comes in, and it gets a lot colder, everything gets wet. So how am I going to manage my diabetes accordingly? also being out for multiple days, you have to charge things, right? So it could be as simple as bringing a battery pack. Setting expectations with partners, I think, is really important. And I rock climb, and I have not always had diabetes. And before I had diabetes, I was a professional rock climber. And I then had to start, once I had it, go back with my partners and kind of understand, like, who did I still want to be my partner, right? Like, who was still comfortable with me and who was I still comfortable with? Because you have a really close relationship with when you're climbing. So the first thing I do when I climb with people is say, like, hey, like, I'm going to be fine, but these are the things that you need to know if things hit the fan. And they need to be confident and calm about that also. My favorite story is my best friend. We climb a lot together, and she'll have a CGM receiver on her, and I'll have my phone, and we'll be like hundreds of feet apart on a wall in Yosemite, and we'll both know my glucose value. And then I think another one is recovery. I know this is about exercise, but it's when you like exercising, it's really important to remember to recover. And it's kind of counterintuitive because it's like, all right, exercising helps my blood glucose stay in range, but exercising too much doesn't help. So how do you kind of draw that line and decipher it? Yeah.
Great, thanks, Maggie. And then these are just like some rad pictures of Maggie doing super cool stuff.
That's my dog. That's Encinitas. This is the Eastern Sierra, my favorite place. That's Joshua Tree for both of them. That's practicing big walling on the left, which is hard because you can't bring a lot of water with you when you're on a big wall. And then...
What kind of snacks do you have with you?
Chili mangoes in my pocket at all times. And then I usually have Cliff product with me just because it's easy to have along for the ride. And then this is a surf trip in Mexico. This one was actually funny because I'm vegan, and I was down there. I work for the company Athleta sometimes doing photo shoots, so I was surfing for them, and the waves were huge. So coming up to the trip, they kept talking about how it was like, the swell's great, and I was like, oh no, like, I don't know if I can hang. And I paddled so much, and it was hard for me to get enough food. So I drank a lot of beer and ate a lot of beans that trip. And it was great. But I was like, this isn't what the other models are doing.
So this is a different type of sugar surfing. And that's a sweet surfboard too. I'm going to ask you about it later.
And then I think this is Mammoth mountain biking. This one's been fun. Mountain biking's fun because there's a lot of like kind of unpredictable exertion with it. And also keeping an insulin pump safe during a wipeout is also a skill that I've had to develop. Yeah.
Okay, great. And of course, Maggie is like a hardcore awesome athlete. So then this talk isn't necessarily just for those people because the rest of us aren't as cool as that. And it doesn't have to be. So a lot of these things, whether your exercise is walking or whether it's surfing like overhead waves, a lot of the ideas are true regardless.
Yeah, and that's where I come in. I'm the yoga, power walker, novice golfer. I used to surf a lot. Someone asked me, it's been like 4.5, maybe 5 years since I've been surfing, but I need to get out. Maybe Maggie, you'll come with me, take me out. And then, and then I'm willing to try almost anything, and I love to travel to new places and try new adventures and spend time with family and friends. So yeah, I'm kind of the more mellow person when we're talking about physical activity and diabetes, and so we have kind of both sides to that, so it's good. And then diabetes management techniques, my idea, just like yours, is planning ahead whenever possible to avoid highs and lows, Goal is to reduce having to eat to work out, feeding the insulin. That's huge for me. I want to kind of pre-manage as much as possible. There's always times when you have to eat, yes, but you don't always have to eat to work out. And I think that's something we can kind of talk about too. And then I really like using, if you're on a pump, temp basal, or some of these ideas of, bolusing a little less before and those kinds of things, just so you can kind of decrease your insulin that's active in your body while you're working out to kind of keep your blood sugar at a good range. And then like this whole conference is like all about CGM. I mean, makes your life so much easier. Yes, you can do it with a meter, but there's nothing like, we all know, or most of us know, and hopefully everybody can have the opportunity.
If you don't know, now you know. It's
yeah, but and cost is a huge issue, and so not everybody can afford a CGM, and that's a huge issue that we haven't even addressed. And but yeah, having a CGM is pretty cool, and the whole idea of moving the arrows, keeping your blood sugar in range. And my motivation is to feel good and worry less, and do whatever you want to do, basically. And CGM and appropriate dosing techniques are my help from technology, and my favorite partners, of course, my family, my husband, friends, and sometimes just me alone, which I'm finding is very cool too. Oh, I love Maggie's pictures, so I put pictures up too. I was in New York last week, and that's in Australia with my husband, and then a family wedding, yeah.
Okay.
Oh, and that's diabetes camp on the other side, Camp Wanakura. If anybody here wants to volunteer for a really cool volunteer, at a camp in San Diego, it's a super fun adventure.
All right. So I do have a few slides I want to get through, just against sort of as a background. But I want to save time to talk and open this up for questions and discussion, because I think that's the most important thing that we can probably take away from this talk and mostly from this whole weekend. First of all, a couple of general safety things just to think about, depending on where you are and how much you've exercised, and if you're thinking about getting going or doing a new routine. One thing is, is exercise safe for you and how aggressive you want to be with it. So just think about, this is a general list of cardiovascular risk factors. And earlier, Jeremy told us that people with diabetes, the most likely thing that you're going to die from, just like everybody else, is heart disease. And so you have to at least, these things have to cross your mind. And depending on how many of these things you have, how many of these diagnoses you have or risk factors you have, your risk may be higher. So it's worth talking to your diabetes provider or your other doctors about, exercise and what type of exercise. Thinking about, do you have diabetic complications? And will those affect your ability to exercise and the type of exercise that you do? So if you have retinopathy, or if you have neuropathy or ulcers or other problems, obviously that's going to limit your options to some degree, but that doesn't mean you can't exercise. So don't let that be a barrier, but it may mean that you want to talk to your specialist about that. And you can always start with shorter duration, low intensity exercise and kind of increase that intensity and duration as you get in better shape and as you're figuring out how to handle your blood sugars during that time. All right, so exercising with type 1 diabetes, we know it's good for us, but how does it affect your blood sugars? Well, a lot of this has to do with really the type of exercise that you're doing. And the other takeaway, which you've heard before and you know it yourself, is that there's so many variables that it's never going to be exactly right. And so you're not going to be able to say, if I do this type of exercise, my blood sugar is going to do exactly this. But this does give you some idea. So, these bloods down in the green arrow at the bottom, there's certain types of exercise that tend to push you more towards hypoglycemia, okay? These are things that are longer duration, generally more aerobic, lower intensity. So things like cycling, running, long walks, things like that will tend to, over time, lower your blood sugar. And other types of exercise that maybe are more anaerobic, are more intense, usually shorter duration. That could be things like weightlifting or sprinting, or a lot of times competitive sports that really raise your excitement hormones and adrenaline. These things will actually push you towards hyperglycemia. So it's not just exercise, but it's the type of exercise you're doing. But ultimately, you have to figure out what each type of exercise does for you. So figure out what kind of exercise you're going to be doing, and then think about before, during, and after your exercise, what's happening to my blood sugars. So before you begin, you always want to say, all right, what's my blood sugar before I start exercising? And of course, what direction is it going? So we got to use the trend arrows, right? And this is where a CGM comes into play. How much insulin is in your system, right? Is it just basal that's floating around? Did you give a bolus recently? Do you have a correction going on? So how much insulin's on board right now? When did you last eat? What did you eat? How much? What type of exercise are you going to do? How long are you going to be doing it? And kind of what's your general goal? These are just sort of general things to think about. But it's going to affect, all these things will affect your blood sugar. So there's a ton of variables to kind of go into this. And so, but the most important one really is what's your blood sugar, where's your blood sugar going, and how much insulin's on board, okay? So hyperglycemia and exercise is a problem, but I think one of the big things is preventing hypoglycemia, right? Preventing low blood sugars. So what can we do? Well, we want to plan ahead. And here's some things, these are some reasons why exercise can cause low blood sugar. So first of all, you're using your glucose, right? It's your energy, and if you're exercising, you're using it up. And exercise can also increase blood flow, and so if you've given yourself a bolus of insulin or even an injection of long-acting, whether it's, or from your pump, you may absorb that insulin faster. So the insulin itself might have a sort of a different rate of effect. And then also very importantly, physical activity increases insulin sensitivity. And that can happen during the exercise and also potentially for many hours later. So the same amount of insulin is actually going to lower your blood sugar more, okay, just by the fact that you exercise. So you have to kind of plan ahead for these things. So what can we do? Just some general approaches. These are just very sort of generalized, but just some things to think about. So let's say you're doing an exercise that's a relatively short duration, right? Something under an hour. And you're going to exercise, but you have some insulin on board because you recently gave a bolus, okay? If you have time to plan ahead, which you should be doing if you can think about it, you might want to reduce your bolus before the exercise, right? It seems obvious, but it does take some planning. So if you're going to have a meal before you exercise, think about cutting that dose down. Depending on what kind of exercise you're going to be, you have to decide how much. Maybe you're only going to get 50% of what your normal bolus would be because you don't want all that extra insulin on board. And of course, if you're sort of between meals and you just have your basal going and not a lot of insulin on board, you may think about snacking before you start your exercise, potentially, depending on what you're doing. If it's a longer duration type of exercise, then it can take even more planning. So you really want to think about reducing your boluses before you start the exercise. If you have a pump, then you want to consider adjusting your basal rate. So doing a temp basal or switching to a different profile even. And then you want to be able to snack at regular intervals if you need to. Okay, so have those snacks available, and if you've done this type of exercise before, hopefully you'll have some idea on whether or not you're going to need to snack throughout, and also depending on how long you're going to be doing the exercise. If you're going on a 6-hour bike ride, you're going to need to have some carbohydrates with you. So again, the plan also depends on your starting blood glucose. So these are just very, very general ideas, but it's a starting place. So if your blood sugar is, first of all, if you have a low blood sugar before you exercise, and I'm talking low, you're hypoglycemic, well, first of all, you may want to reconsider exercising, okay? So maybe treat the low and then come back to the exercise later, maybe tomorrow. But if your blood sugar is looking good, but it's a little bit on the low side, maybe it's in the 80s or something like that, you may still want to take some carbohydrates before you start. Okay, so, and again, this is very individualized. So it may be maybe 10 grams, maybe 20 grams. And then you can use your CGM if you have one to wait until your blood sugar starts to trend up. And maybe you'll see that little bend in the CGM curve, and that'll be a good time to actually start the exercise. If your blood sugar is at a good place, like 90 to 140, 150, you may or may not want to snack before that. But there's a good chance if you're doing low intensity exercise, you can just go and exercise. Now, if you have higher blood sugars, let's say 150 or higher, and that 270 cutoff is, in the real world, that's somewhat arbitrary. But if you have a really high blood sugar, then you also want to think about, is this a good time to exercise? Now, a lot of times, if you go out and go for a walk or go for a swim or something like that, you'll actually improve your blood sugar. So that may be a great time to exercise. So you might not need to eat at all, and that's actually going to improve your outcome. If your blood sugar is super high, you may even think about doing a ketone check. So that's not something that people do routinely, but if you have a ketone meter or urine ketone strips and your blood sugar is super high, if there's a risk that you might have some elevated ketones, exercise might not be the best option. So if you have that available, it is a good thing to consider. CGM. For the sake of us talking about it. What are you going to do with the CGM sort of during your exercise? So, again, it comes back to the trend arrows. So, based on where your glucose level is and where it's headed, it may help guide you in terms of how much carbohydrates you may or may not need, okay? If your blood sugar starts off high and the trend arrow is flat, maybe you're good to go. You're just going to go start your exercise. If your blood sugar is at 100, but there's 2 down arrows, that means that you're falling quick. So you don't want to start exercising without eating something and waiting for those trend arrows to flatten out. So really use those trend arrows. It's probably something that we don't utilize enough in making these decisions. Okay, so I've been exercising like you suggested, but then after exercise, my blood sugars go to crap and everything's crazy. And this can happen. So they can go high, they can go low, and you're like, well, I exercised 3 hours ago and I'm still dealing with the after effects. It's really common. So if you notice that after your workout, your blood sugars go up, so why might that happen? Well, a lot of people will actually suspend or disconnect from their pump during exercise, and that's not necessarily wrong. But depending on the duration that you're exercising, your body is actually going to run out of insulin pretty quick. And then even if your blood sugar looks good during that time period, by the time you reconnect, you're behind the 8 ball. So it's going to take a while for the insulin that starts to come back into your body to catch up and start to work. So thinking about that. Exercise can sometimes delay food digestion. So if you ate before you exercised, then you go and exercise, a lot of that blood gets pulled away from your GI tract, so it's not absorbing. And then as soon as you're done exercising, you're going to start absorbing that food and your blood sugar is going to go up. Maybe you ate too many carbohydrates, too many snacks, you didn't really need them. And then maybe just the exercise itself, adrenaline and things that were related to the exercise can make your blood sugars go up during and after the exercise. So what can we do about it? So limiting the amount of time that you suspend or disconnect from your pump, I think is a good idea. Again, it works great for some people to suspend for a period of time, but I caution people about that because even if it looks great during the exercise, you may pay the price later. And then, timing, if you're using a temp basal rate, just figuring out the timing and the amount to increase it or decrease it by is really important. And so that's something that really just takes trial and error, and there's no way for anybody else to recommend how much to do it, but you got to try it. So maybe you put your temp basal on at 80% and you started a half an hour before your exercise. Maybe that's too much, maybe that's too little, but it's a trial and error type issue. And then if you're bolusing, if you're going to eat a snack or a meal before you exercise, you may actually want to give half of the bolus for that coverage and then actually plan to give the other half at the end of your exercise. And that may actually help balance out the absorption and timing of that food if it gets delayed, if you notice you think you have delayed absorption. And of course, you can always eat less carbohydrates if that's the main thing that's driving you up. You can always give a bolus, of course. So what about lows after exercise? So you're using up your glucose. You may have too much insulin on board. You may be absorbing your insulin faster than you're used to, even though you're using the same amount. And maybe you didn't eat enough carbohydrates. So one thing that you can always do, again, this is more with people with pumps, but you can temporarily lower your basal rate for up to 12 hours after exercise. In fact, 12 hours is just an arbitrary number. It may be even longer, okay? Maybe 12 hours plus overnight. If you're using injections and you can plan ahead, you may proactively also want to lower your basal injection. So if you're using a long-acting basal and you know you're going to exercise that day, you may say, hey, I'm going to give 80% of my normal injection, so decrease it by 20%. And then you'll be able to see during and after you exercise how that affects you. So again, if you're bolusing before exercise and you don't really know what the effect's going to be, it's always okay to give a smaller bolus, all right? So give a half of a bolus, and then if things are running high later, you can always correct for it. All right, exercise every morning, but I get lows in the middle of the night. So again, this is really important, and I think we forget this all the time, is that the effects of exercise, and in particular what I'm talking about is that insulin sensitivity, can last for a day or even up to 48 hours. So it really can stick around for a long time. So how do we deal with nocturnal lows or try to prevent them after exercise? So if you're exercising for a long time, make sure you refuel, right? Because you've used up your glucose. You can consider having a bedtime snack, but if you do that, you don't want to have a bunch of fast-acting carbs because those are going to come and go out of your system, right? So you want to have some longer-acting carbs and then mix it with protein and some fats so that basically carries you through the night. Now, I hesitate, and maybe after this I'll ask Laura to comment on this. I hesitate to ask people to snack before bedtime in general because I don't think it's a good habit. But if you've exercised that day and your blood sugar, and you're fighting low blood sugars or you think you're trending down, do it for sure. And then, of course, if you can, reduce your long-acting insulin at night. And I think a safe place to start is reduce it by 20%. So you can put on a temp basal overnight, or if you're given injections, say, hey, I'm going to give 80% of my normal dose. That way, you have a less of a chance of going low because that basal rate won't be pushing you down. All right? Now, ultimately, again, this is so personalized, it affects everybody differently. So you got to practice, and you really have to just be conscientious of what's going on before, during, and after your exercise. Watch your blood sugars. Start slow and set goals for what you want to do. If you have a CGM, use it. If you don't have a CGM, the concepts are still the same. You just have to check your finger sticks throughout the time. Make sure you're doing it before, and if it's a long, exercise, you have to check during the exercise as well. Take a break. Make sure you have some fast-acting carbs available in case you need them. And this is just kind of a general safety thing, but have some type of med alert bracelet, especially if you're out exercising, if you're biking, if you're doing things with people who may not know that you have diabetes. Because if you have a bad low, or God forbid an accident happens, you want people to know this because it really could save your life. So get an alert bracelet or like a rad tattoo or something that people will find. Okay, cool. So that's it for the slides. So maybe I'll pass it back to Maggie and Laura and see if they have any comments on that. And then what I really want to do is hear y'all's experiences. So when have you had a problem where you got super low when you're exercising? What did you do about it? And see if we can kind of talk about the experiences there. Okay, great. They have nothing. So
Covered
good.
it all.
Okay, try to yell it out. Otherwise, I'll bring this mic over.
Oh, that's right. I'm loud. I don't need a microphone. So, I know that athletes fuel their exercise who don't have type 1. So I think the idea that we can just go out there and drop our basals or reduce our bolus and somehow not take in carbs is, I've just found nobody can do that, and it's not performance enhancing, and it's not, I think you can do it for short periods, but you do need to fuel.
Yeah, and that's when I was saying earlier, I wasn't saying that you wouldn't fuel for the physical activity. I'm sorry if that came across that way. I'm talking about having to, treat for lows, feed the insulin for a low blood sugar. But no, especially like somebody like Maggie that's going out for, somewhere between 4 hours to 12 hours to 2 days, it's really important to focus on your nutrition, make sure you're getting balance, make sure you're getting carbohydrates. You need those for your quick energy, but you also need your protein for sustained, and some fat just so you can kind of, so your blood sugars aren't going all over the place. No, I'm not talking about not fueling for exercise. I'm just saying you don't want to feed the insulin for a low. The whole idea is to avoid low blood sugars during physical activity. But that's a good point. Thank you.
So you fuel as you go.
Absolutely.
Partly you're preventing eventually a low in some sense. Because if you didn't fuel, you would have a low, period. It's a little tricky language, right?
Right, and I totally agree with you. Yeah.
Yes, it's a good point. I mean, as you said, you need fuel just to do the exercise, and so I think even if you're reducing your insulin, or even just if you're even completely disconnected from your pump, you could theoretically have a low because you don't have any glucose on board. But
it's a good point. The food that I eat during ultra marathons from before I have diabetes till after is exactly the same. And when I was in college, I didn't have diabetes, and I would eat like 15 grams of carbs every 40 minutes, and then every other hour I would add some fat or protein in there. And then once I got diabetes, I was like, all right, I'm gonna try it again. And I came up with the exact same outcome, basically to stay flat. And it made me proud of my pre-diabetes self for figuring it out. But it also just makes you feel good, right? Otherwise you feel kind of like hungry and like you can't do things.
Yeah.
So.
Good. Come over there. Here. Good. You're good.
So I just started on a pump about 2 months ago, and I'll be going, it's kind of exercise related, but I'll be going to Mexico in November. So I'll be going in the water, I'm sure swimming. And the pump that I have is not waterproof, water resistance. How should I approach this?
So, should I take it? So, you have a tube pump?
Yes.
Yeah. And so, you're going to be planning your day. So there's something we didn't really discuss, which is something that a lot of people do, is they do, basically you'll use a little long-acting insulin, like half of your basal, and you can, give if you're disconnecting for hours on end, yeah. And so you can give yourself like I'm losing the term, there's a name for this, but anyways, you take half of your Lantus dose. So during your physical activity then, you're disconnected from your pump, okay? And you're getting half of your basal, so you're like on a 50% temp basal. And then when you're on your pump, you run a 50% reduction, or you could have a profile that is 50% of your background. That way you have insulin going all the time, you have your background insulin going, and you're still gonna need to connect when you eat and when you're on, if you're going in and out of the water and eating and having lunch and all those kinds of things, you're gonna still need to reconnect and think about doing a reduction for that meal coverage by somewhere around 15 to 30 grams of carbohydrate reduction for the physical activity if it's gonna continue. But, so that's something you can do with your pump. You're kind of new to pumping? Okay, yeah. So, and the other thing is when you're traveling too, it's really important to bring long-acting insulin, especially when you're going out of the country. I know this isn't related necessarily to exercise, but with travel and exercise, you want to make sure you have a long-acting Basaglar or Lantus or something with you in case something happened to your pump. But yeah, you can do this kind of tethering or something. I can't remember the name of it. Is that what it is? Tethering, yeah. What's that?
She doesn't need to disconnect. There are different packs that she can put her pump in that are waterproof.
Yeah, but that's true too. But you're in Mexico, she's not necessarily, there's different things you can do.
In Mexico, we keep it someplace. I would keep it on all the time.
So there's lots of options, yeah.
Hi, it's a question from Maggie, because you're traveling a lot. I do fundraising for Diabetes Canada, and I end up in some pretty far out places. Are there any websites you know of or places where I can find, I like the idea of just dropping into a pharmacy in Indonesia and picking up some insulin. I like to know that I'm fluid enough and nimble enough to get what I need, even if it's old school, where I'm going. Do you know of any places where you can learn about do you need a prescription, or can you just drop in and buy it?
I don't know. I guess, and maybe like Schafer or Laura know, my approach is I always just have a lot of stuff on me. Yeah,
I've never heard of such a thing, such a resource. Yeah.
I went to Uganda, Africa. You can just go in the pharmacy and buy insulin. I've been to Colombia, I've been to Brazil, and my pump actually broke in Brazil.
Yeah. For better or for worse, it's in most countries you can walk into the pharmacy and just buy things. Certainly in Mexico you can, and all this kind of. But you don't know what kind of insulin they're going to have for sure, right? And maybe they have regular insulin, and then maybe they don't, and who knows? Maybe they won't stock insulin. So it's tough. I think the answer is as much as you can bring your own. Because if you're going to rely on what they have in the village that you're at, who knows? It's a good question though. Yeah.
If I may.
Well, I'm just curious too, because I want to retire somewhere else, and it's need to know where
Yeah.
you can get the lowest cost stuff and then have a great lifestyle.
Here.
I'm Gigi, and been diabetic since I was 21. I'm now 57. And what I would do is bring shorter-acting insulin and put it inside a water bottle to keep it cool so that you have it with you at all times. So that was really helpful, like in Mexico and different things like that. The other thing I will share is I, too, am new to the Dexcom. I have a Dexcom 5. I'm on Social Security disability. I've been diabetic since I was 21. And where I've run into trouble with the Dexcom is sometimes the numbers are 100 point different than my blood sugar tester says. So that gets really confusing to me of what to do there. The other thing I'll share is I get really tired of the glucose tablets. I really crunch, But what I've started doing is the baby food as a way of getting 20 carbs in. And it's stage 2 for 6-month-old babies, and it's got mango and spinach, and I wear a little pack that helps, and I carry it wherever I go. I saw people here having the low packs type of thing.
It's good for people without teeth.
Oh, that's my boss here. He has very little teeth. Mr. Downtown, Bobby Brown. He's emotional support pet for me, and he turned 15 last week. And so, but what I will share with you for people who do exercise a lot, and this really caught me and was very devastating, it's part of the reason I'm here is because it's caused a terrible depression for me, is I walk anywhere from 6 to 10 dogs every day, okay? And I go between approximately 5 to 10 miles every day. I've lost 55 pounds since 2011. But where I've run into really big trouble is no one ever shared this with me, is by having too many low blood sugars. I'm past menopause, I have ADD and other things, PTSD, but I was told that I have advanced white matter now in my brain from too many low blood sugars. And so people need to be aware. All I've ever been told is, well, when you get a low, fix it, catch it, and one leads to another type of thing. But people need to be aware it is creating a new epidemic out there.
Yeah. Thank you, Gigi. Yeah, I mean, hypoglycemia is scary, and it's something that I think a lot of people, you know, especially for people who've been dealing with diabetes for a long time, who have been trying to keep their blood sugars from being high, getting used to the idea of preventing lows as being really an urgent issue is new for some folks. So thanks, Gigi.
Hi. I've been diabetic for 49 years, and I got it when I was 22. I have to say, thank God I'm in good health, because they had nothing then. And I think what saved my life was exercise. I mean, I did everything they told me not to do. Really. You know, you doctors just knew nothing. But I found, and you know, as I age, there are things I can't do anymore. Like I used to snorkel for 8 hours a day, sometimes, you know, depending where I was. I cannot do extreme sports anymore. I've had a couple of injuries, that kind of thing. But what I'm finding, I'm 72, might as well stand up. What I'm finding is that my body has changed over time. I'm going through one of those things now. When I go to the gym, there's so few people. I've never met a doctor in all those years that knew what to do. I had to figure everything out by myself. It's all trial and error, and I'm a brittle diabetic. I take half a unit for lunch, you know, to give you an idea. I'm very sensitive. Normally, I don't know if it's all the years of exercise, but I think I've always been sensitive.
What do you do for exercise now?
Well, we're gym rats, my husband and I. You know, I get on the treadmill, I do weights, I work with trainers. The one thing I can't do, because my sugar drops so fast, is classes. Half hour, I'm done. You know, when I try and do extreme things, like the metabolism workout kind of thing, which...
That excuse for years.
Well, I think we got it at the same time, so you know what I'm talking about. But anyway, what I need to know now, because I'm in the midst of going through a change, and nothing seems to work. Before I go to the gym, I eat. I have to eat something. I don't eat big, and I'll have a piece of toast and something. And I watch my sugar. My sugars go up very fast and down. So I try and get to the gym just under 200, because the minute I start on the treadmill, it comes right down. Then I do weights. But trying to keep that balance is getting harder and harder. Yeah. So I didn't know if anyone had any ideas, but there aren't that many people as old as I am that's been working out that long. And
yeah. So
it's always a guessing game.
It is a guessing game. And so you have a CGM, and even with all those tools, it can be difficult. And depending on the day and the type of exercise that you do, any comments related to what she has to say?
Yeah, doing high intensity workouts too, like I swim, and usually for an hour, you're basically sprinting for a complete hour. So on your line of that, I usually try to get my blood sugar at a steady 180 before I start, because obviously things are gonna start dropping pretty fast. And it can literally drop 100 points in like 10, 15 minutes or more. The other thing, I used to go back and forth between maybe trying to do something low glycemic as a snack before, so it's gradually going up as things are going down, and that just never seemed to be consistent. So for me, like every time I do a set, you're doing a hard set and you come back to the wall, every time and anytime you're stopping, whether it's at the end of 2 laps or 6 laps or 8 or whatever, I'm just constantly sipping on like apple juice. And it's a quick way to get it. It doesn't, it's a little hydrating as well. But for me, especially with something that's going to go down that fast, that's pretty much the most consistent way that I've been able to keep things from getting too low,
Yeah.
I'm wondering, when I'm exercising, hopefully I'm trying to keep the weight off, and then, it's not for a long duration, like maybe an hour at most. I'm interested in the glucagon as something to cure a hypoglycemic episode rather than more carbs. Can anyone talk about that, or rather than eating something more?
Yeah. Great question. And so glucagon, I think that's something that a lot of people are interested in, because unfortunately, if you get in the cycle where you're having lows and you need to eat, and then sometimes you go high and you need to take more insulin, and so you're neither eating nor insulin is going to help you keep your weight down. So they're seems counterproductive. So there are, thankfully, among other companies, Xeris, who's one of the companies here, is developing sort of a microdosing glucagon pen. Nothing is available right now, but it's something that I think will be available. So being able to, basically like an insulin pen that you can give a tiny little dose of glucagon is exactly what you're talking about, and that's coming. So the glucagon now that they develop is stable at room temperature in a liquid form, and so I think that's going to be where that is really useful, among other uses. But certainly with exercise, you want to give a little tiny dose of glucagon and have your exercise. So we actually have to wrap up, guys, because we're moving on, and we're going to have Jeremy come in with his song. So thank you all for coming. Appreciate it.